Generalized anxiety disorder is the fear of not being able to control life events. For example, speaking in front of people can be very overwhelming, or events happening not the way that you thought they would happen. For example, today in church, me and my wife were supposed to do an Advent reading. They asked us about a month ago to do this reading, and the pastor showed up today and asked if we were ready. And we said no, we never got a script. So there he handed us the script and right up as we went on stage. I felt so much anxiety doing this. I started sweating and shaking uncontrollably. I handed my wife the microphone and the script because I was shaking so terribly. We did the skit just fine, and I don't think anyone in the church noticed my shaking. This is an example of acute anxiety. There is people in the world that feel this way just more than once a day. They feel this way more often than not. The rush of uncontrollable emotion that happens most days, lasting for a period of 6 months or more, is diagnosed as generalized anxiety disorder. The symptoms can include shakiness, irritable bowel syndrome, and not being able to focus on the current task at hand. Generalized anxiety disorder is often referred to as GAD. That is what I'm going to refer to it as from now on. Nearly one half of the people diagnosed with GAD have major depression as well. These two diagnoses go hand in hand with each other. Usually if you have one, you have the other. A little over just 1/3 of the people diagnosed with anxiety disorders seeks treatment. Some people diagnosed with GAD lean to drugs or alcohol to help them make it through the day. This obviously takes away their pain and makes them not think about their anxiety disorder. Or does that make them sweat or get nervous or have excessive worrying? This is obviously not the ideal route to be taking. Treatments include medication, cognitive behavioral therapies, and some other forms of outpatient therapy too. GAD is normally associated with the depletion of serotonin in the neural synapse, which in turn prevents the neurons from firing correctly. The selective serotonin reuptake inhibitors are the most commonly prescribed drugs for panic today and offer fewer side effects than the tricyclic antidepressants. The thought behind SSRIs is that allows serotonin to remain longer in the synapse by blocking the reuptake. One common SSRI is fluoxetine, and the brand name is Prozac. Cognitive behavioral therapies include exposure therapies and other sorts of ideas in which exposing or reliving the moments that gives the patient anxiety. Another way is reproducing the physical symptoms such as sweating and high heart rate. An example of that is running around a track would cause you to sweat and have a high pulse, which is exactly what some people have during an anxiety attack. When done correctly, 70% of the people have shown improvement with cognitive behavioral therapy. GAD in most severe forms have made people consider suicide to escape the rush of emotions. These people feel like they have lost all hope of ever getting better, and this is their way of ending their pain. This is not the answer. With so much more understanding and promise in our medical field, there is always help for you. They might just need to feel like someone else cares about them, and they need an ear for the time being. Listening to someone who is hurting deep down can make the world of difference, along with spreading education on mental illness.